contact tracing has been initiated and all are self-isolating. This is not unexpected. We know that with international travel patterns and the spread of this virus, that we are likely to have cases related to travel in this province. Please appreciate that due to privacy concerns, I am unable to confirm or release any further details. As of today, in Newfoundland and Labrador, there have been 791 people tested. Of those individuals who have been tested, 787 have been confirmed negative. There are 300 people in self-isolation, and these individuals are being followed by public health. I understand that as cases are detected in our province, that people may be scared. This is a normal reaction. Please know that this is part of the public health process. Our public health officials are working tirelessly and are well prepared to respond. I would like to take the opportunity to thank everyone for following our public health advice and rules that we have put in place. These are important measures to help protect the health of those in our province. I also want to thank those that have identified their risk for COVID-19, who are self-isolating and are coming forward to be tested. It is important that we detect cases. Doing so will reduce the risk of transmission to others in our communities. So I thank you for doing your part. We must remember the importance of adhering to the principles of social distancing, maintaining a 2 arm length distance, and staying at home unless it's essential. Remember to wash your hands regularly and to use good cough and sneeze practices. Feeling unwell or experiencing symptoms of or cough, I know these are challenging times for all of us, but we are a resilient province and will get through this together. Let's support our family and friends in self-isolation and each other by making sure we abide by these measures. We all have a role to play in reducing the spread of COVID-19. Thank you.
Thank you, Dr. Fitzgerald. As you know, earlier this week I said that we are in unprecedented times and that we are moving through uncharted waters in our province, in our country, and around the world. This message has not changed. What has changed, however, is the number of cases that we're seeing across Newfoundland and Labrador. Our health officials are watching the curve of new cases very closely in our province. And while we navigate our way through these uncharted waters, we have made a number of important decisions over the past few days for your health and your safety. On Wednesday, we announced a public health emergency. Today, we are making a decision that will further protect you from the spread of COVID-19. Today, any individual returning from out of the province will be absolutely required to quarantine for 14 days. This includes international travels and those arriving from another province. We will do everything within our power to implement the strictest screening measures possible to protect Newfoundlanders and Labradorians, including implementing health assessment forms to be completed at the point of entry of the province. Understanding that our province will require a flow of goods, things like groceries, household supplies, medical supplies, we will work extremely closely with Marine Atlantic, OceanX, and our trucking companies to make sure proper measures are in place to receive those goods. Details of today's announcements will be discussed and reviewed closely, and we will be taking further action in the coming days. We must act now. If this situation wasn't serious, we would not be doing this. We are looking at implementing any and all measures that we can that would help contain COVID-19 to protect Newfoundlanders and Labradorians. We have an advantage. We are remote and rural in many areas, and particularly in Labrador and through the island portion of Newfoundland, and you would say that our geography many times has been to our disadvantage. But there's advantages in this particular case. We are an island, and islands off this island and include remote Labrador as well. So as your Premier, I will do whatever it takes to protect you and your family. This is our main priority. I cannot emphasize enough Keep social distancing top of mind. Wash your hands, as Dr. Fitzgerald had just said. I understand that this is a difficult time, and I understand that this is a stressful time both as individuals and for your family. If you are feeling anxious or stressed, please reach out. You are not alone. We have a number of mental health resources available to our province for support and your guidance. Whether it is you, a friend, or a family member, we ask the individuals to visit bridgethegap.ca to access our government's mental health services. Our provincial warm line is available to you if you need to talk to someone who is trained and has lived experience. And if you're in a situation of experiencing crisis levels, our mental health crisis line is also available to you. We have a remarkable sense of community. Newfoundlanders and Labradorians are known for their kindness, and they're known for supporting each other. I am still in awe, yet not surprised, of how we saw people come together during Snowmageddon in January of this year. I continue to have that feeling now as I see many examples of people helping one another and lifting people's spirits during this pandemic. I also want to thank the many community volunteers, our healthcare workers, who are dealing with stress in their family and stress in the workplace. You are doing a remarkable job in protecting our province. We have weathered many a storm together as Newfoundlanders and Labradorians. Let's keep our community safe. We'll do this together. Let's all get out to support one another. At this point, I'd like to turn it over to Minister Haggie, to Dr. Haggie as well, for more comments.
Thank you, Premier. Dr. Fitzgerald. Again, I must emphasise the hard work and diligence exercised by our small but mighty group of public health officials in the province. We have now in place some of the most cautious restrictions and moves to try and contain and limit the spread of this disease. It is important that we get out ahead of this, and we have an opportunity to do that. I'm going to highlight several things that we are doing and will be doing over the course of the next literally few days. We will be moving on a regional basis to assessment centres for testing. Those people identified by screening and after consultation with public health will be given appointments for testing centres. Each region will have a number of these. The locations will be worked out over the course of the next couple of days. Certainly for the island portion of the province, I'm aware that the three regional health authorities on the island are looking at a drive-through model. This is efficient, by appointment, and will minimize exposure of public and staff to what risk may be there. Labrador Grenfell, looking at the Labrador portion of the province, may opt to do things slightly differently, simply to reflect their geography and not surprisingly, the weather. These will be done on the basis of recommendations from public health and from testing, and I would refer anyone who is at all worried to our website, 811healthline.ca, to perform a self-assessment and then be guided by the results of that. One of the social distancing issues that we have seen has been around requests for virtual care, where the provider and the patient or recipient of care don't actually have to physically either travel or meet face-to-face. And I'm pleased to say, as of the last hour or so, we've reached an agreement with the Newfoundland and Labrador Medical Association to provide virtual care immediately. In actual fact, we will retroactively compensate physicians who have been doing this going back to the start of our emergency health declaration. We, through the Newfoundland and Labrador Centre for Health Information, are happy to provide a free platform for those physicians who don't have one, and we will also provide free support for that platform. If you as a physician already have a platform, you can continue to use the platform you are, and obviously you would have your own support arrangements. This ability for virtual care applies to any family practitioner, any specialist. It applies to care delivered by phone for those people who have bandwidth issues or those people who use a virtual care platform. We've heard concerns over drug supply and pharmacies, and we are aware from our contact with the Pharmacists Association that wholesalers, for reasons which we are looking into and exploring, are actually being cautious with their drug supplies. As a result of that, prescription refills now through the pharmacists will be for 30 days. We're looking at ways to support seniors and people on drug cards who would otherwise have to pay an unusual amount of dispense fees. We would advise that anybody who wants to have a prescription renewed, call ahead to their pharmacy. There are certain categories of medication for which script renewal automatically may not be appropriate, and I'm thinking of antibiotics here where we don't want to overuse them, and controlled drugs which are actually subject to federal regulations which are slightly different. These pharmacies, some of them as well, have also expressed an interest and an ability to manufacture hand sanitizer, and we have cut through the red tape to enable that to happen. And as far as I'm aware, as coming to this meeting, what obstacles exist are simply logistic now for the pharmacies in terms of getting their ingredients, mixing them and distributing them. To move on to the issue of equipment, we have been keeping a very close eye on our supplies, our consumables, our PPE as we've called it, personal protective equipment. We have daily inventories being prepared. I had a lengthy conversation with Minister Haggie yesterday to make sure that we have an itemized list by the end of today from her about what supplies we have ordered, where they are, what the numbers are, and when we can expect delivery dates. We had heard concerns raised about ventilators. We actually have a better ratio of ICU beds in this province than, for example, the state of New York. We have 50% more ventilators than we do ICU beds, but we have gone to the federal supply chain and asked them for another 20, and that order was placed as recently as this morning. So again, our main focus is around looking at the current problems, how we can best deal with them. Our best defense is containment and isolation, and I would urge everyone in the province to exercise their responsibility as a resident and a citizen of this province to protect themselves, to protect their families, and to protect their loved ones by following the instructions and recommendations that we have put out about social distancing, about minimizing gatherings. It will be a challenge. I had teenage girls once myself, and I know that it's very difficult to keep them apart, particularly now they have time on their hands. Whatever we can do to help you with that, we will try our best. But again, it's down to each and every one of us to help ourselves. So with that, I'll conclude my comments and hand it back to the Premier. Thank you.
Well, thank you, Minister Haggie. So questions from the media?
Good afternoon, everyone. My name is Kathy Dix-Payton, and I'm the Media Relations Manager with the Department of Health and Community Services. I'll be your moderator for today. So any reporter who's here in the room or on the line, if you would come to the microphone, identify yourself and the outlet you represent before you ask your questions. Thank you.
Peter Cowan with CBC. When you look at the provincial border in Labrador, there are a lot of people who go back and forth to Quebec, either along the Straits or in Labrador West. And you also have supply chain where you may have truck drivers who are coming in from out of the province. Could you please address those two issues and how that 14-day new isolation period is going to affect those people?
Yeah, so we recognize this, Peter, and you're right. There's a lot of activity happening in Lab West, and we've been looking at this very closely. We've been speaking to some of the people that would be part of the logistics in that area. And of course, we have, people that are connected to the mining industry, as an example, that would be working in Quebec that would use the Wabush Airport. So we're looking at arrangements now where people would not have to go through that airport. They would kind of be bussed into what would be like a site outside of there, but yet would have access to the charter planes that would take them to their final destination.
And just the second part around, you have, for example, truck drivers coming in with groceries, right, and they've got several deliveries they're making in the province. Obviously, a 14-day isolation is
Right. So,
doesn't really work for
and
them.
that's another good example, and I addressed that in my comments here, realizing that this is not about disrupting the supply chain of goods and services like food and medical supplies that would come into our province, but yet this is about protecting people of our province, and there's no question we will have to take somewhat of very abnormal decisions to protect the health and safety of Newfoundlanders and Labradorians. The idea here is to contain, to delay, and protect Newfoundlanders and Labradorians. And some of those decisions may seem extreme today, but the benefits of making those decisions today could mean that Newfoundlanders and Labradorians are kept healthy.
We've seen the fire chief of the Howley Fire Department has said his crews will not respond to medical calls because they do not have personal protective equipment. Often firefighters are the first ones who can respond and provide medical care. So first of all, what is the advice for first responders in terms of their risk? Perhaps Dr. Fitzgerald could address that one. And secondly, what are you doing to provide personal protective equipment and ensure that you don't end up with people who end up getting delayed care because of this?
Well, I'll address the first part of that because I don't think Dr. Fitzgerald would know much about the community that you're talking about. I'm aware of this, and we're working very closely now with that group to actually get the proper and updated equipment in place so that they are in a position to be able to respond to the emergencies that happen in that small community. This is an example of communities coming together in Newfoundland and Labrador, and us as a government must need to continue to work with those communities to make sure they get the equipment in place so that they can properly respond.
Peter, to respond to that as well, we have a provincial emergency operations centre. We have a logistics contact person there who actually co-chairs the National Logistics Advisory Committee. And only as recently as yesterday, we heard from St. John's Regional Fire Department, they had a requirement for masks. We helped them out from our provincial supply. We have gone to the National Emergency Strategic Stockpile, and we are expecting a week's supply from them in the very near future, in addition to our regular orders.
Marie-Isabelle
just-
Rochon from...
One moment. Kellyanne Roberts, NTV News. I have a long list of questions here. For those who are now going to be self-isolating, it is as of those that are traveling back as of today, and it is for a 14-day period from the point you return, not just if you got back 5 days ago, now you only have 9 days to self-isolate?
This is where we are now, but it's important that everyone, as Dr. Fitzgerald mentioned this morning, that you be cognizant of where you are, and if indeed you're seeing symptoms, to call 811. Fill out that self-assessment tool. It's getting quite a bit of traffic, quite a bit of interest. And as you enter, so the idea here would be is that if you're a traveler coming into Newfoundland and Labrador, we want to make sure that we can gather as much information as possible, keeping in mind that there are charter rights that we have to consider as well. But we want to go out there and make sure that we protect Newfoundlanders and Labradorians first, and getting this things like a self-assessment tool, getting that completed on the in-flight coming into our province. This is where we want to be. It's important that we get the information. It's important that we know where those individuals are traveling from before they get to our province. And this is where we want to be to protect Newfoundlanders and Labradorians. Gather this information so we can protect the people that live here in this province today and slow down the spread of COVID-19.
But it's for those that have returned as of today moving forward?
Yes. So when they come into the province, this is something that we will need to put in place so that for people that coming into the province today would then have to do a 14-day mandatory quarantine.
Also looking for some clarification for, I know substitute teachers and early childhood educators still have questions about EI, if they qualify, if they don't have enough hours, what's being put in place there?
Well, there are many federal initiatives that were announced this week that would, hopefully be able to make provision for those people that you're just mentioning there. We're still working, with the childcare centers and daycare centers to actually put services in place for essential workers as well. We know this is a priority, as an example, for the Nurses Union, as an example for NAPE. So if we know this is not going to be days, we know this is weeks and months, so we're going to need to put services in place, as an example, to support essential workers. But yet those that you've mentioned, like substitute teachers, there's already a budget component that we have within the Department of Education and Early Childhood Development, but yet still, if this is not enough, we'll look at the federal opportunities and options that are available to support those that have been displaced because of COVID-19.
Just looking to clarify then, is there a link they can go to, somewhere they can go to see about these funding options? Because now some people have been off for a week now and not knowing where their income's coming from.
Yes, so much there is information on the federal links around EI and the changes and how you would support individuals that are in a position that they are now out of work because of COVID-19.
We'll now take a call from the telephone lines.
Hi, Marie-Isabelle Rochon from Radio Canada. With what's happening with COVID-19, with the drop of oil, with Muskrat Falls, with everything going on in the province, with the fiscal situation, is the province heading to a bankruptcy? What's going to happen? What can you tell the resident of Newfoundland regarding the fiscal situation?
There's without question, and I talked to all my Premier colleagues yesterday, there is no question that this has had a significant and severe economic impact on Newfoundland and Labrador. First and foremost, though, our priority is protecting health of Newfoundlanders and Labradorians. The economic issues that we're facing right now is certainly changed where we were in February of this year and early March. I would say within the last week we're seeing a dramatic decrease in the price of oil. What we're seeing are revenues decreasing and we are seeing expenses increasing. But right now, as I said earlier, our priority is on protecting health of Newfoundlanders and Labradorians, the economy of Newfoundland and Labrador. We are expecting that measures that we're taking today will help us rebound faster than other jurisdictions. It's important that we do the right thing now to protect the health of Newfoundlanders and Labradorians as we continue to deal with the economic impacts from COVID-19.
Other question to Dr. Fitzgerald, just a precision look. How many are presumed case and confirmed case?
So at the moment, we have 3 confirmed cases in Labrador Grenfell Health and 1 presumptive positive case in Eastern Health.
Thank you. And last question, how is the province helping the more vulnerable people who don't have enough money? Is there a clear plan for them? What can they do today? What is the province doing for helping the most vulnerable here in the province?
Yeah, some of the initiatives that we've seen announced earlier this week by the federal government and will be supported by measures that we will put in place by the province. And we recognize that this is having a severe and extreme impact on families and some business owners within Newfoundland and Labrador. We'll continue, as we have, to work very closely with them. And, we also have the Emergency Operations Center that's opened up that could help direct people that are experiencing hardship today, that will help them navigate their way through the system to where supports are available for those that are severely impacted today.
Can you explain those measures precisely? What can those people expect?
Well, there's a number of measures that will be in place through income support, through the EI program that the federal government just announced this week, and the child care benefit as an example, the increases in GST and so on. There's a number of measures that are now in place as a result of the decisions that were made and announcements by the federal government earlier this week. And we'd encourage everyone to go through our Emergency Operations Center if you have questions, and that will direct general inquiries to the appropriate departments for their support.
Thank you.
For the benefit of reporters, we're asking 1 question, 1 follow-up per reporter per question, please.
Hello, it's Angel Moore from APTN.
Ben Murphy, VOCM. Premier Ball, just looking for an update on the Offshore and if their employees are expected to self-isolate for 14 days when they come back.
Well, the idea here, if you leave the province, if you're coming into the province, you would isolate mandatory quarantine, self-quarantine for 14 days. These are strict measures. We know there will be impacts on people that come into our province, but again, the idea here is to contain, delay the spread of COVID throughout Newfoundland and Labrador.
And Minister Haggie, just wondering if we have any idea on when we'll start to see these testing centers start popping up.
That's a good question. My understanding is Labrador Grenfell have actually started one there already. Western and Eastern are probably going to start up in the next 24 hours, and Central by Monday. Hello? Yes?
Angel Moore from APTN News. One question, kind of a follow-up. The other reporter was asking about vulnerable people and people along the northern border of Labrador. There some concern happening right now is the groceries, the food is running a bit low, is starting to run low. So I'm asking how you're preparing to get supplies up there. I know there's an airstrip up there, but there's also concern that the airstrip does not have any lights that are available for nighttime. So there's concern about supplies and possible evacuations if people become sick.
I didn't get the last part of your question, but I did get the first part. If I understood you correctly, it was about, you know, the ability to get food and supplies into the northern regions of Labrador. We do work very closely with with the distribution centers up there, and realizing that this time of the year it comes with its challenges every year as we move into the spring season. But we're working very closely with the groups up there to make sure that we maintain a supply of goods into Labrador, in particular into northern Labrador. And so, you know, we will continue to work with those groups. And as you know, and as I just said, there's been challenges as we get late into the year to see supplies running low into that area. But we'll continue to work with those communities through the Office of Labrador Affairs, with the distribution sites, you know, in Labrador, and with our own Indigenous Affairs office as well.
The other part of my question was that when people become ill, if you need to evacuate people, and with the airstrip that's only accessible during the day, there's no lights. Is there a plan for evacuation or to get people treatment?
Yeah, there's been ongoing issues, as you know, with the Nain Airport through lighting, and we've been working with the federal government, as this is their jurisdiction with this airport in Nain. So we're working very closely with the federal government for many years now, as this has been an ongoing challenge for the people that live in Nain. And we'll, again, as I say, work with the federal government and including, you know, the Nunavut government to address those concerns. So far, I can say, is at least to my knowledge, I've not been aware of any Medevacs that have been missed coming out of there related to COVID-19 as a result of the airport in Nain.
Premier, if I may, Nain in actual fact has one of the most advanced iterations of virtual care anywhere in the country, and led the world as early as 2010 with Rosie the robot. And in that first trial period of 18 months, it converted, I think, 120 Medevacs, which would have had to go in through search and rescue or other means, into Skedevacs, where they could be taken out during the day. So we have some experience of this. Obviously, anything we can do to improve that, we'd be happy to look at.
We're now going to have a larger number of people who are self-isolating, because there's lots of folks who are coming back from outside of the province. A lot of people are wondering about people who don't follow the rules, despite the fact that there are potential penalties. Yesterday in her briefing, Dr. Fitzgerald said to call someone. Can we get some more details on what specific action you'd like people to take if they're concerned about someone who is clearly violating the rules that exist?
Through our COVID-19 website, we are working with OCIO. Hopefully by the end of the day, we will have a Contact Us section there, which will pop up and require populating with some specific details. A lot of the, until recently, a lot of the commentary we've received through email has been, you know, two people with a suntan were walking down the street in Gander, should they be out and about? And that's not been terribly helpful. So we're hoping to firm up the quality of the information we get. And obviously, if that is a significant challenge, then we'll try and find some ways to meet it. Some of these procedures, if you like, it's likened to retuning and rebuilding a car engine while the vehicle's actually moving. We are in uncharted waters here. We're making some sensible, or what we believe to be sensible, first steps, and then as the situation evolves, we will adapt and deal with the challenges that arise. So it's not a perfect plan, but it's better than waiting to see what happened. We don't want to be Italy, we want to be Singapore.
If I could add to that, is a few days ago, we put in place a public health state of emergency in this province. And there are consequences for those that follow those rules. And we are prepared to do whatever it takes to make sure that we protect the health of Newfoundlanders and Labradorians. We raised this in our meeting this morning with our all-party committee on public health. And I think it was Chess Crosby who said we should be in a position to ready, fire, aim. And I actually support that concept. We do take this seriously. We're not here today simply just making decisions to protect people that we're not willing to follow up on. There are consequences that those who make irresponsible decisions to walk around a community coming out of a jurisdiction and could actually help spread COVID-19 through communities. We will do whatever it takes to prevent that.
There are guides to self-isolation up on our website, so we hope to be able to make those more widely known as the number of people who have to self-isolate increases. How to do it, what it entails, what you can't do, and what you can do. People do need access to fresh air, but you've got to do it by yourself and in a way that's socially responsible. And if you have symptoms, you shouldn't be out and about.
One of the questions is about testing. You mentioned, for example, Singapore as a jurisdiction. It and South Korea have done a lot of testing, even asymptomatic people. I believe South Korea, they've done hundreds of thousands of tests. A lot of people are wondering, why aren't we doing more widespread testing now, especially now that we are seeing more cases in more areas, to know faster if we're seeing community spread, for example?
If I may, we're testing anyone who has influenza-like symptoms. We added that to the panel. If you don't have symptoms, you will have a negative result. It may sound a bit gross, but unless you've got a runny nose, there's nothing to swab.
Dr. Fitzgerald, the man that has recently been identified as being the 4th case of COVID, assume it's presumptive at this point, and did he self-isolate immediately upon returning?
So my understanding is that he self-isolated very quickly upon returning, but not immediately.
Premier, this one's for you. With everything that's ongoing in terms of our public health state of emergency, Muskrat Falls, oil, everything that's going on in the province, do you see it appropriate that we're holding a leadership race right now?
On February the 17th, when I made a decision to leave politics, this was a very different world. This was a very different province than it is today. I would not have left and made that decision on February the 17th, knowing what I know now. I didn't know this at that particular point. My priority right now is not about the future of the Liberal Party of Newfoundland and Labrador. It's about the future of Newfoundland and Labrador and its residents. That's my focus right now. The party will make whatever decisions they want, but I will continue to be the Premier and lead this province through this process as long as I am Premier of this province.
Thank you.
For a little bit more information on...
Excuse me, Patrick, we have a reporter here ready to ask a question. We'll take your question shortly after.
Okay.
Just looking for an update on what's happening with correctional facilities. You said that was going back and forth between justice and health, but can you just give us any kind of update on correctional facilities?
Nothing really to add since my last comments. It really falls in the jurisdiction of Justice and Public Safety at the moment. From an administrative point of view, we would take over responsibility on the 1st of April and then gradually, as it were, acquire programming and integrate that into Eastern Health. There are measures in place to provide virtual legal services. Beyond that, I would suggest you best direct your questions to the minister responsible.
And Premier Ball, just further to Kellyanne's question, it seems like now there's been a bit of divide within the party about whether this leadership race should go ahead or not. Can you speak to that divide?
I just tell my caucus to unify. We're making great progress with the all-party committee on how we deal with this public health issue, and it takes experience to get through this crisis that we're dealing with in our province right now. It's important for all of us that are elected officials that sit in those 40 seats in this House of Assembly to represent the people that put us there in the chairs that we sit in, not to be discussing in an open forum of who the person would sit in some open chair that could potentially come up. It's important for all 40 MHAs to unify, and we're seeing great unity on our all-party committee. And so the message that I would send to my caucus today, and I followed a bit of this, and I said to someone this morning, or someone said to me this morning, it takes experience to do this job, and not often do you see a postcard or a card on the back of a fire truck that says novice driver.
Patrick, if you're still on the line, your question?
Yeah, I'm still on the line. Okay, yeah. So I'm looking for, Patrick Butler, Radio Canada, looking for a little more information on the sort of border checks that you're talking about, the point of entry check. Could you just list off, all of the points of entry that you're kind of focusing on here, and would you mind detailing a little bit more about how those checks will work?
Border checkpoints.
Yes. From the point of view of the principal numbers of risk, this is about the number of people crossing into the province. So from a public health perspective, the main focus in the first instance will be on the ferry and Marine Atlantic and on those points of entry by air. The points of entry will be reduced significantly over the course of the weekend as Air Canada cuts down its flights into Gander and into Deer Lake. And so beyond that, the issue of road access is really around industrial and commercial activity related to the mines up in Western Labrador. And we may have to look and work closely with our Quebec colleagues and the industrial owners and operators of the mines to do that. From the point of view of public health and passenger transport, at the moment, Marine Atlantic and the air operators are screening people at the point of boarding. So if their mechanisms are as robust as we hope, then symptomatic people will simply not get on the planes or on the ferries. Ours will then be a second line of defense, and we're looking at a public health, a health self-assessment questionnaire at the point of entry, where folk would get the same questions that they have on the online survey at the moment, and then sign a declaration that they have filled that out honestly and leave that at the airport or the ferry terminal before setting off to go straight home. We will have some clarity around information that will be provided at those points of entry. We've not yet, as I said, we're building this plan as we go. We've not yet determined what physical presence will be at the port of entry, or whether that will be someone in a uniform or an environmental health officer or quite who that would be. And we'll also aim to provide advice to returning travellers, ideally before they get off the plane and the boat, and in the electronic age we can do that. We are literally modifying our website. We had all our frequently asked questions ready to post, and then we realized that we were going in a different direction, so we're actually retyping them as this meeting goes on.
Yeah, so I want to apologize. I couldn't get the question when you asked it, but the whole idea here is to gather information so that we can, support people as they come into our province as well. But as I said so many times today, this is really about containing and delaying the spread of this virus throughout our province. We are in a unique situation geographically that we think that we see this as somewhat of an advantage to us, realizing that it's not perfect, but it's good progress.
Hi, phone question from Canadian Press.
More questions from the phone lines?
Yes. Canadian Press. I'm wondering about kind of looking at the risk factors that we know of for this disease, being, people of advanced age and underlying health conditions. Those are kind of two characteristics that are very present in Newfoundland and Labrador, even compared to the rest of Canada. So I'm wondering how that overall health profile of the province is being taken into consideration with preparation and, measures being taken in the health system right now.
We monitor this very closely, and some of the changes that the minister, on the recommendation of the chief medical officer, made earlier this week about visitation, within our acute care centres, within our long-term care centres. We realize that when it comes just not to Newfoundland and Labrador, but indeed all of Atlantic Canada and some degree Manitoba, that we have an aging population with a very high prevalence of chronic disease within our province. And so for us, we have some of the most vulnerable in terms of percentage-wise as any population within the country. Added to that, We have, 5 Indigenous groups within our province as well. So we have a lot of vulnerable people on a per capita basis in Newfoundland and Labrador, and that is the reason why we took some strong measures earlier this week through the state of emergency through our Health Protection Act, but also today where we're taking the additional measures of people that visit our province or come back home to Newfoundland and Labrador. They will be a mandatory 14-day quarantine, and we will be using a self-assessment tool as they enter the province to gather that information.
And as a follow-up to that, I mean, given all the risk factors, are you concerned at all about supply of ventilators and those kind of materials that might be needed if a lot of people end up having complications, if there's a real serious outbreak in the province?
We have looked at the epidemiology that's out there, the number of patients that would require hospitalization across the globe seems to be a fairly small percentage of the total number infected, which is why we want to slow the rate at which people acquire this disease, or ideally contain it completely. In terms of ventilators, we have 50% more ventilators than we do ICU beds, and we have ordered more of the ventilators. We have the ability to convert other inpatient beds into ICU beds should that need arise. But per capita, in terms of ICU beds and ventilators, we're better off than some of the jurisdictions, say, for example, like New York City. Our ratios are way more favorable currently, recognizing that we have a more elderly and generally slightly less healthy population than other parts of the country. So again, we've made steps down that road. Are they enough? Ask me in 3 weeks' time and see what we need to do as the days go by.
Do we have any more questions from the phone lines before we put this back to the floor?
Yes.
It's Peter Jackson from the Telegram. I have a couple of questions about privacy. A little while ago, a boy in Maine died of tuberculosis, and it was quite publicly known that this disease was being tracked and contacts were being traced. There were stories on it. In this case, we're only given a region. Now, information has been spread around, I know, on social media as to exactly where this person was, even their occupation. And so I'm wondering, what concerns do you have about privacy, and is there a consistent approach when it comes to privacy?
Privacy is top of mind. One of my 35 acts, which as health minister I'm responsible for in law, is the Personal Health Information Act. The issue around that case in Nain, those details were not revealed by the health authority. They were out there in the public domain. The information that we are putting out in the interests of public health is consistent entirely with what other jurisdictions have done, and we will continue to do that. Beyond that, I am not about naming names and pointing fingers at street addresses. That is totally inappropriate.
Are there any final questions from the phone lines?
Can I have a follow-up?
Okay.
I know this seems very trivial, but it's a question I've got before, and I see it online a lot. And so I have to ask Dr. Fitzgerald, people want to know how you are actually coping with this.
Well, it's been a bit overwhelming. Thank you for asking. Our public health staff has been working tirelessly. I cannot say enough good about them, and everybody is supporting each other. So it's challenging, but we're doing okay.
As Premier of the province, I guess I can speak on behalf of the residents and the team that we have to work with. The fact is, these teams are usually small, and what many people wouldn't realize in this situation, as you look at it, you think that government was so big there would be hundreds of people. It's not the case. These teams are very small. They work very long hours. And Dr. Fitzgerald, in my view and my assessment, I will tell you, is doing a remarkable job with a small group of people that she would have working with her. And I think every single Newfoundlander and Labradorian can be very proud of the work that she's doing and the service that she's providing, not just to us as leaders in our province, but to every single community, every single resident across this province. And I can say that on behalf of every resident because I see and the work that she's doing very closely. So I would really want to say thank you to her and her team for the work that she's doing.
Yeah.
We need a little more clarity about the border between Labrador and Quebec. You talked about some mining flights, but along the straits, there are people who live in Labrador, they work in Quebec, or vice versa. There are people who go across for supplies. And in fact, if you take the ferry, you are going into Quebec in order to get to Newfoundland. So how is all of that going to work?
Complicated. They're families, Peter. They're families that have relatives in Blanc-Sablon, the Quebec side, and in the Labrador Straits. And we've considered this, and we want to work with those groups. It's not about making it is about making sure that people have those family connections. And we know that we utilize the healthcare sector, the healthcare services, sometimes in Quebec, and likewise they come into Labrador as well. So the objective here is to make sure we get the information in place for people as they come into the Straits area, and likewise as Newfoundlanders and Labradorians go into the Quebec side. So there's some work that we need to do there, working with the community. This is really about, as I said, making sure we protect Newfoundlanders and Labradorians, and in this case, even protect people that live in Quebec as well.
My follow-up, we're hearing about shortages of things like masks and gloves, even hearing that some hospitals are putting these under lock and key in order to keep track of supplies. What sort of shortages have we seen, and have there been instances where doctors have not had the N95 masks or other essential equipment?
The only situations where physicians have, that I'm aware of, been unable to access masks is in those private offices who have traditionally been responsible for their own supplies as standalone. Having said that, the use of N95 masks in those settings is essentially minimal. The standard for mask use is different than I think some people realize. N95 masks are only needed under very specialized circumstances where what's called aerosol generating procedures are performed. These are things like intubation, surgical maneuvers on the airway, bronchoscopes. These are not the kind of things you would see outside of an operating room or an intensive care or high dependency unit. We are focusing on the basis of best evidence on preserving the use of N95 masks for those areas. We know clearly from the evidence that other healthcare workers are adequately protected with a surgical face mask and shield, and we are not aware of shortages in either area. As I said earlier on, we're getting our regular supplies. They trickle in each day and they are used each day. And in addition to that, we have gone through a national mechanism and through the National Emergency Strategic Stockpile to ask for extra under those circumstances. I'm still waiting for Minister Haggie to get back to me today with our list of delivery dates and amounts.
With the recent announcement of now anybody who's traveling into the province having to self-isolate, we're seeing everything evolve by the hour here. Are we looking at closing non-essential stores and businesses, retail stores, for example?
We take these decisions, through the working with the Chief Medical Officer, and as I said, this is, as Minister Haggie just said, it's kind of like building the car with the engine running, so there's no question, we'll make decisions based on the evidence and the advice that we receive, and so far this is not where we are today, but that doesn't necessarily mean that we would not be there very soon.
Dr. Fitzgerald, we're seeing the age range of COVID-19 kind of turn here, seeing a lot more people in their 50s, 40s, 20s. There's a New Brunswick boy under the age of 10 now that's been diagnosed with it. What can you tell us about how it's evolved now and it's in younger people as well?
So, I mean, there were always younger people who were getting COVID-19. It appears that older people and people with other underlying medical conditions were being more severely affected. So initially, we probably saw more of those cases because those would be the people who would have presented. Once we start looking for more cases, we're going to find a much broader age range. And while children haven't been a highly represented group being infected with COVID-19, we have seen children all over the world who have gotten infected. So it's not unusual to see some children here in Canada as well.
Question about...
Yes, hi. A response to the location of people infected. We all know that you can't say their names or their addresses, of course, but the Labrador-Greenfield region includes Labrador and the Newfoundland, the tip of Newfoundland. So I guess a lot of people seem to be worried. That's quite a large region, and it makes quite a big difference whether the majority of the outbreaks are on the island or on Labrador. And other provinces are saying which city or which community is infected, but you don't want to let people know just for the sake of mind.
The issue about comparing us with other provinces, if you say you've got a case in Kelowna, that's completely different than saying you've got a case in Black Duck Cove or Green Island Cove or somewhere like that, because it's very easy then to identify because of the small and close-knit nature of traditional Newfoundland and Labrador communities. We have been consistent, and we will give out the details of age and sex and travel, and we will do it by health region. That is entirely consistent with what is done elsewhere, and we are not proposing to change.
Question about swabs. We've seen a call has gone out through the NLMA to any doctors who have extra swabs in their office. Get them in the courier. You want them now. How many swabs are you? And is this a sign that there are not enough swabs within the regional health authorities to be able to deal with all the testing that's needed?
We decided to do this because on average we waste 2,000 to 3,000 of those swabs every year. And someone, and I can't honestly remember who it was, says, why not just ask for them back? They don't expire in this season. Why not just use what we've got rather than waste them? And that was where that came from. We have had 2 new swab kits approved rapidly by Health Canada. They've been very helpful, and swabs are not an issue currently.
Premier, many people wondering, will the government tendered contracts continue to be paid to vendors that have services that may no longer be required, but indirectly employ people at these vendors, such as school bus drivers, building maintenance, and others?
Yeah. So from what I know right now, we've had this question, got an update, which has really been a couple days ago now, that those contracts will continue to be honored because we realize, the impact that this could potentially have as well. But, again, we'll see how long this lasts. We'll continue to work with the people that have been working with us for many years. But what I know right now is that there's none of those contracts that have been discontinued.
Are there any further questions?
One from the phone.
Go ahead.
Yeah, my question for Dr. Fitzgerald is pretty straightforward, but I'm just wondering if technically your title is still interim Chief Medical Officer of Health, and how long you've been in your position.
I guess technically it is. I've been in this position since September of last year.
If I may, we've removed the title interim, but she hasn't signed a contract yet, and I don't know whether that's deliberate or not.
So we'll accept it. We'll accept the petition from those across the province now that will want to remove that.
Scared her off.
Yeah, you still
Good
want the
Thank you.
position after
Good
that?
question, Holly.
Looking for some clarification, wondering if self-isolation is needed if you're traveling between Newfoundland and Labrador.
No.
Are there any further questions?
I have a question. Peter Jackson with the Telegram. Dr. Haggie, I don't often call you doctor to start your post, but you just said that there are no issues with swab resources in terms of swabs now. And we have got the impression before that they're being used very judiciously. You're waiting for new kits to be developed. So if there are no issues now with swabs, does that indicate that you might consider increasing the criteria for taking tests?
The issue with swabs is we have 2 new kits that we have purchased, as well as supplies in hand. The issue about who gets tested and under what circumstances is done on the basis of clinical criteria. Dr. Fitzgerald and her team have provided consistent advice which has not changed. Should that change, we will re-examine our test kit utilization. But at the moment, there is no indication that we need to do that.
So with no further questions, the time for questions has ended, and we thank you all for coming.
Thank you.